Absolutely delighted to be here. It is the 10th Environment, Health and Wellbeing Conference. And so, as always, we're really pleased that this is a conference that we're working with the ESRI and HSE, and it's really important that state bodies are coming together and working together on topics, and this topic being, I suppose, one of the most important that we can possibly deal with. Today's conference, as Martina was saying, focuses on changing perspectives in environment, health and well-being. And because it is the 10th conference, I suppose I'll take a little bit of time reflecting back to the differences from 10 years ago to now with regard to where we're at with regard to environment, health and well-being, and really looking at the changes that have taken place in that time. And when we were looking at this conference, myself and my colleagues looked back at the programme to the first conference that we had, really just to remind ourselves what were the topics of interest at the time, where were we at. And what struck us that at that time there was two aspects really to the conference. The first was to promote a greater awareness of the impact of environmental quality on human health. And in the past 10 years, environmental quality has really embedded itself even more firmly as a central pillar in health protection. There is much better recognition and awareness of the key role that environmental factors play in determining health outcomes. And today our conversation has evolved to broaden. It's including things such as the cumulative and combined exposures of environmental stressors on health, how our changing climate is a threat multiplier and the need to put health at the centre of climate action. Really importantly, how environmental and socioeconomic inequalities cause unequal exposure to many environment and climate-related health hazards. And of course, the even more increasing understanding and awareness of mental health and well-being impacts from climate and environmental exposures, as well as the psychological impacts of climate change and environmental degradation. So a huge amount has changed in our awareness over the last 10 years. The second part of the conference, kind of back in 2016, was to realise the benefits of a good environment for health and well-being. And again, we've come such a long way. This idea of a good quality environment supports health and well-being, a really positive message, and one that I think we can't forget, because we tend sometimes to talk about the negatives, but actually all of those positives about how a good quality environment supports all of our health and well-being. And the health benefits of a vibrant natural world are countless. Our environment provides us with breathable air, with water to drink, with productive soils to grow our crops on, as well as a space to spend time in and enjoy, enhancing both our physical but also our mental health and well-being. Engagement and contact with our natural environment is associated with measurable improvements in health and well-being of the population. Getting outdoors, using our green and blue spaces have a multiple of benefits to our health. And whereas I think we knew it intrinsically, we knew it that actually being out in the outdoors, and all of us as kids, I'm sure we were told, you know, go outside, play, or we're saying it the same to our kids, get off the machine, get outside. We knew it in ourselves, but as time has moved on, there is a growing body of scientific evidence that points to this beneficial effects such as better mental health, improved physical activity, stress reduction, and increased social interaction. And the EPA's most recent State of the Environment report, which we published last year, it highlighted 5 overall priorities for Ireland's environment, and a key priority centred around the close link between environment and our health. And that shows you how important we in the EPA believe that link between health and the environment is, because of those 5 key priorities overall, one of them specifically we're calling out health and the environment. And in truth, over the last 10 years, a central message of the EPA has been that we need to protect our environment to protect our health. And in looking back at how we spoke about environment and health topics almost 10 years ago, our conversations were different, and we tended to look at things in a single and issue-specific way compared to now, when we're much more talking about things in an integrated and systems-based approach. The evolution has been driven by growing evidence on social environmental determinants and health. I think the COVID-19 pandemic was instrumental in kind of looking at that systems-wide impacts as well. And of course, the climate crisis has had that impact as well. And just, again, its growing knowledge in this space has supported that. So designing environments that promote physical activity, mental well-being and social cohesion, reducing car dependency, encouraging active travel and incorporating nature and access to good quality green spaces is central to health protection, health promotion and more resilient cities. There is also really positively a growing shift towards integrating well-being into our built environment. This is especially important as we know that our population is really growing, and indications from the likes of ESRI, CSO, saying that potentially we could have a population of up to 7 million people by 2050. So how we use our limited land space is incredibly important as we've more people living in cities, and we're talking much more even about things like apartment living. That makes it even more important that people have access and equal access, for example, to green spaces. And in the context of our State of the Environment report, again, this highlighted anew for the EPA to start discussing specifically about investment in infrastructure. But we identified scaling up investment in environmental infrastructure across transport, across housing, across energy, across the circular economy, so that the potentially growing pressures on our environment by that increased population don't impact ultimately our environment and our health. In terms of promoting healthier, greener and more resilient cities, many of you might have been here last year when Dr. Hans Brennings, who was the previous CEO of the European Environment Agency, he was speaking. And one of the things I must say I really liked in his talk, it was really visual and I think connected with many people, was the importance of access to nature and green spaces in our urban centres, and talking about simple no regrets concept called the 3-30-300 rule. I'm going to repeat it because I just think it's so good. Because what this is setting out is an objective and universal benchmarks for cities to provide adequate and back to equitable access to nature. And this rule dictates that everyone should be able to see at least 3 mature trees from their home, workplace or place of study. That every neighbourhood should have at least 30% tree canopy cover, and everyone should be at a maximum distance of 300 metres from their nearest high-quality public green space. So I think this idea of being able to see trees, being able to be near nature and recognising that is important for our health, but as said, done in a really visual way that I think we can all connect to. And this isn't coming out of nowhere, of course. It draws on extensive and expanding body of research demonstrating the important role of trees and public green spaces, especially those located near where we live, work and study. Designing our settlements to promote well-being, to regulate potential pollutants that harm us, and to ensure that every person, regardless of age, of income or location, has access to a clean, healthy environment must continue to be a priority in years to come. And of course, I need to talk about climate change, and I don't think we can have a health and environment conference without talking about climate change. It remains the greatest health threat facing humanity. It has the potential to challenge the substantial health gains that we have achieved over recent decades. And climate change is already impacting our daily lives. It is not something that is going to happen to some people far away into the future. It is happening now. Health impacts from extreme weather events, infectious and vector-borne diseases, air quality, airborne allergens are all the more apparent. It is also a threat multiplier, exacerbating many significant environmental hazards, health hazards. Research from our colleagues in the ESRI has highlighted how rising temperatures in Ireland are already affecting healthcare and outcomes, especially back to the most vulnerable in our population. Storm Éowyn has brought severe and widespread disruption across the country earlier this year, also highlighting the impact of extending and cascading risks across critical infrastructure, with hundreds of thousands of households, of farms, of businesses left without power, some for weeks on end. The communications network, water treatment, water supply networks, the transport network, as well as healthcare and emergency systems were all impacted. And this cascade of failure, which we experienced because of the storm event, had significant impacts on the health and well-being of many of our communities and the most vulnerable. Urgent action is required to address these vulnerabilities and to enhance the resilience of Ireland's critical infrastructure to the change that we know is coming with regard to climate. Indeed, the risk of disruption and damage to communications and energy distribution infrastructure due to high wind is one of the significant risks that we identified in the National Climate Change Risk Assessment published by the EPA in June. And that risk assessment is the first comprehensive assessment of where and when and how climate risks are likely to impact Ireland in the coming decades. A central finding of the chapter in the State of the Environment report also emphasised that climate adaptation measures are, although they're being implemented at an insufficient pace and in a very fragmented way. We need to place human health and well-being at the forefront of our climate preparedness. And we need action to implement ambitious climate adaptation and mitigation measures that can deliver health co-benefits. And I will keep coming back to particularly those of us or those in our population that are most vulnerable. Because what we are seeing again and again is those that are most vulnerable get impacted across all aspects of stressors. And the inequity, the unfairness of that is something that we have all a responsibility to address. The message of prevention was highlighted in the EPA's State of the Environment report. Protecting the environment is key to protecting our health, and we must act now to reduce the modifiable risks to our health and environmental exposures. We're seeing avoidable diseases and early deaths due to environmental risk factors, with the European Environment Agency reporting that at least 1 in 10 premature deaths in Europe are driven by exposure to polluted air, water, soil, noise and harmful chemicals. And just maybe to touch on a couple of those. In Ireland, air pollution, and we pride ourselves on having relatively good air quality, but air pollution is still the single greatest environmental threat to our health. Over 1,700 premature deaths each year due to poor air quality. Noise, often termed the forgotten pollutant, is more than just a nuisance and has significant health impacts. For example, research and strategic noise mapping in Ireland estimate that transport-related noise impacts over 1 million people in the country. Radon, which is natural radioactive gas that the EPA and prior to that the Radiological Protection Institute have been highlighting the impact of for many years, We're seeing now with the revision of radon maps that the EPA has produced that actually there is an increased risk from radon in Ireland, particularly in Munster and Connacht, with over 170,000 homes now predicted to be at risk of radon exposure greater than the national reference level. So it is, in fact, although we always knew it was an issue, it's even more of an issue than we previously anticipated. And many of you may have seen or heard the reports on the EPA's urban wastewater treatment report last year, or last week, and what it's highlighting for 2024 is that while raw discharges from urban wastewater treatment plants have halved in the past year, we still have untreated sewage from around 20,000 people being discharged into our environment every day, as well as plants that have the capacity not treating wastewater appropriately. So our understanding, for example, in some areas such as chemicals is also increasing, and forever chemicals, PFAS, are of note now as a chemical group representing a major public health and environmental issue. And this is something that is, I suppose, a kind of evolving knowledge as well. And I don't predict what Ian says, but I may refer to PFAS as well, because the European Environment Agency's Environment Report highlights that human exposure to PFAS has been estimated to cost 52 to 84 billion euros in annual health costs in Europe due to endocrine, immune, reproductive and developmental effects. So this has a health impact, but it actually has a significant economic impact as well. So look, there are just some of the figures that we're talking about when we talk about hazardous chemical exposure, all causing unnecessary, avoidable impacts to the environment and to the population. The good news of all of these is that these risks are modifiable. Through smart policy, investment in critical infrastructure, community engagement and individual action, we can reduce those harmful exposures and enhance protective ones. And lastly, and just maybe coming to the end, is I really want to highlight, as I've talked throughout, mentioned throughout the talk, that environmental exposures don't impact and affect everybody in an equal way. There are marked differences in the vulnerability of certain cohorts of society to environmental hazards. People already in poor health, young and old people, people with, said, socioeconomic status more disadvantaged. All of these people are impacted by environmental hazards to a greater extent than others. So we must be really conscious of these disparities in environmental exposures and ensure that there's targeted actions and measures directed at those most vulnerable in our society, so that we're creating a healthy environment for all. In the past decade, significant impacts and developments have taken place across environment and health. On a really positive note, awareness has grown. People understand that intrinsic link between environment and our health and well-being. Discussions on these topics have increased and are increasingly reflecting that integrated and systems-based approach. These are all really positive if we're going to address the current challenges that we face. And it's also really important that solutions can help one issue can have multiple co-benefits for others. So lastly, just to highlight the importance of prevention. Improving environmental quality by reducing harmful environmental exposures creates healthier places for all members of society, regardless of age, socioeconomic status and region. We know the issues. We know what needs to be done to address them. So now it's the time to tackle them in a meaningful way. And addressing these issues means that people can live healthier, longer lives in a good quality environment. Thank you very much.